All right, let's talk about chronic obstructive pulmonary disease, or COPD. But we're not just going to look at this as some medical condition. Think of this as your guide, a journey to really understand this disease, and more importantly, how you can take back control of your health. To see why this is so important, I want to start with a number. 3 million. That's how many people died from COPD back in 2012 alone. It's just a massive figure, and it immediately tells you how big of a deal this is on a global scale. And get this, COPD is actually one of the top 3 causes of death around the entire world. That makes it a huge public health challenge. But, and this is the part I really want you to hold on to, it is both preventable and treatable. So that leads us to the big question, right? We know it affects millions, but we also know there's real hope. So what exactly is COPD? And the most important part, what are the actual steps you can take to manage it and get back in the driver's seat of your own health?
You know, every journey has to start somewhere. For someone with COPD, that journey often begins when you start noticing the first little clues, those signs and symptoms that make you think, maybe it's time to see a doctor.
So let's break down the official definition. It's a lung condition that leads to long-term symptoms like being breathless or having a cough that just won't quit. And it's all because of damage to the airways or those tiny little air sacs in your lungs. The end result is something called persistent airflow obstruction. Here's a simple way to think about it. Imagine trying to breathe out through a really narrow straw. That feeling of it being hard to push the air out, that's the core problem in COPD.
So when you go to the doctor, what are they looking for? Well, think of this as a kind of checklist. They're looking for key things like breathlessness that just doesn't go away, what they call dyspnea, especially when you exercise. They're looking for a chronic cough, and they'll ask about your history, things like exposure to tobacco smoke. Now, no single one of these confirms it, but when you see them together, it's a pretty strong signal that more testing is needed.
Okay, so those first clues have brought you to the doctor. The next leg of the journey is getting an official diagnosis. This is all about confirming what's going on and, really importantly, getting a clear picture of how it's actually affecting your life.
Now, the way they confirm COPD is with a surprisingly simple test. It's called spirometry, and it's really not a big deal. You just take a really deep breath and then blow out as hard and as fast as you can into a machine. That's it. It just measures how much air your lungs can hold and how quickly you can get that air out.
But you know, numbers from a machine only tell part of the story. A good diagnosis has to include your personal experience. That's where something like the MMRC scale comes in. It's a simple way to grade your breathlessness, from a 0, where you only get winded during really tough exercise, all the way to a 4, where you're too breathless to even leave the house. It's a great tool for measuring the real-world impact of your symptoms.
And to get an even fuller picture, doctors often use what's called the CAT assessment. This one goes beyond just breathing and looks at the bigger impact on your quality of life. It asks about stuff like your cough, your energy levels, how well you're sleeping, and even how confident you feel about leaving home.
So, you take all this information, your breathing test results, your symptom scores, and your history of any flare-ups, or what doctors call exacerbations. A flare-up is just when your symptoms suddenly get worse and you might need extra medical help. All that data gets plugged into this GOLD assessment tool. It helps your doctor classify your specific situation and map out a treatment plan that's tailored just for you.
All right, with a clear diagnosis in hand, now we get to the proactive part. We shift from just understanding the problem to actively managing it. This is all about your management toolkit, the strategies and tools you can use to live better with COPD. And the whole management plan really boils down to 2 simple but super powerful goals. First, we want to reduce the symptoms you're having right now, the cough, the breathlessness, so you can just improve your day-to-day life. And second, we want to reduce your future risk by preventing those nasty flare-ups that can sometimes land you in the hospital.
So, to achieve those goals, the toolkit includes things like medication and education, for sure. But there is one component that is, honestly, the most empowering piece of the puzzle: pulmonary rehabilitation. This is where you, the patient, get to take a truly active role in managing your health and making your daily life better. And don't just take my word for it. The evidence is crystal clear. This is a direct quote from the Global Initiative for Chronic Obstructive Lung Disease, and it says that pulmonary rehab improves your ability to exercise, it improves your symptoms, and it improves your quality of life. And the best part? It works across all grades of COPD severity. That means it can help pretty much everyone with this condition. So what is this rehab anyway? It might sound intimidating, but it really just boils down to 2 core things. First, exercise training.
You'll work with professionals who will help you safely build strength, not just in your body, but in your breathing muscles too. And second, disease-specific education. This is where you learn the practical stuff, how to use your inhalers the right way, how to save your energy, and how to spot the early warning signs of a flare-up. It's all about building both your physical strength and your practical knowledge.
So, we've walked through the whole journey, from noticing those first signs to understanding the diagnosis, and finally, to seeing a clear management plan that's all about putting you in control. The roadmap is there. The only question left is the one you have to answer for yourself.